now we're going to get on to Cara Cross and Professor Catherine McMahon. Cara is a Wurundjeri Biripi woman with family connections to the Garingal and Yuin communities or nations. She is a project officer with Macquarie University's Faculty of Medicine, Health and Human Sciences and the Wollongong Maru area. In this role, she coordinates Aboriginal hearing health scholarships and training, capacity building and data collection within the project. Kath is the Director of Audiology and Director of Hearing Education Application Research and Research Centre at Macquarie University. She is the lead investigator of an MRFF Indigenous Health Research Grant, improving care pathways for Otitis Media in Aboriginal children 0 to 12 years, and an Australian Government Indigenous Australians Health Program Emerging Priorities Grant, the LILAC, Listening and Language in Aboriginal Children. So over to you, to both, whoever's going to take it off.
Good morning. We're able to say good morning, which is just in time. And on behalf of Macquarie University and Wollongong Maru, I'd like to acknowledge the traditional custodians of the lands we're gathered on. Macquarie University is on the land of the Wadawurrung clan of the Darug people, and we pay our respects to the elders who have and continue to share their wisdom and knowledges, nurturing and sustaining our environments, cultures and education, and acknowledge that they hold the memories and the traditions and the hopes of Aboriginal and Torres Strait Islander peoples across the nation. Further, I'd like to acknowledge our research initiatives and our partners that have made this important research possible. We're here today to talk about otitis media, which is a significant health issue in Australia, especially for our Aboriginal and Torres Strait Islander children, with some studies suggesting up to 91% of Australia's Indigenous children are living within the remote communities present with otitis media. Otitis media can show no symptoms, yet left untreated, otitis media can lead to significant hearing loss and medical complications. Mild to moderate hearing loss resultant from long-term otitis media can negatively impact a child's speech and language acquisition and learning, and may also affect their physical, emotional, and social development, while severe otitis media can result in permanent hearing loss and even become life-threatening by causing brain abscesses and meningitis.
Thanks, Cara. So you can see a graph here that was done fairly recently from the National Aboriginal and Torres Strait Islander Health Survey from 2018 to 19 that shows the by age group the proportion of Aboriginal people that had either measured hearing loss shown in light blue or self-reported hearing loss shown in dark blue. And you can actually see the underreporting of hearing loss that does occur in each of the age groups. In general, it demonstrates that Indigenous Australians were more likely than non-Indigenous Australians to have ear and hearing problems. And for all ages, it's 1.4 times as likely. And for otitis media, it's 3 times as likely. If we focus only on the younger age group, so 0 to 14 years, it is 2 times as likely to have ear and hearing problems, and 3 times as likely to have otitis media.
Now, Aboriginal people are underrepresented in our health professions, we know that, and there's no reliable data at the moment about the number of Aboriginal diploma qualified audiometrists that are currently working within our hearing health sector. However, we believe there may only be 2 or 3 in all of Australia. Anecdotally, Aboriginal Health and Child Services note an undersupply of qualified hearing health workers. Our project, the Aboriginal Children's Hearing Health Research Program, to focus on capacity building within the Aboriginal hearing health sector and to investigate the push and pull factors influencing students during their study within our Diploma of Audiometry. Building capacity within the Aboriginal hearing health workforce is significant given the unacceptably high rates of avoidable hearing loss in Aboriginal children and untreated hearing loss in Aboriginal adults, and the importance of culturally safe care. We know culturally safe care is fundamental to the effective healthcare for Aboriginal people, and Aboriginal healthcare workforce is a key enabler for our cultural safety. Using the Poche 7-step scholarship program model, the Aboriginal Children's Hearing Health Research Program seeks to identify all the push and pull factors of enrolment, completion and employment for our Aboriginal diploma qualified audiometrists.
At the moment, there's a strong mandate for action. So in 2019, the hearing health sector report, or the roadmap for hearing health, was endorsed by COAG. And there was a specific section on closing the gap for Aboriginal and Torres Strait Islander ear and hearing health. The government is currently investing in the outcomes of the roadmap in order to address some of the key issues for ear and hearing health. There's also incredibly good evidence-based and consensus-based clinical guidelines that exist for how to address ear and hearing health within primary health. And also there are a number of federal government programs under the ear health programs that incorporates things like fly-in, fly-out services. It incorporates training to conduct ear and hearing checks, as well as equipment. And Hearing Australia that have the community service obligation to address ear and hearing care for Aboriginal people.
And according to Siggins Miller in their Examine Australian Government Indigenous Ear and Hearing Health Initiatives report to the Australian Government Department of Health, as of June 2017, a total of $2.6 million was provided for ear and hearing training for the period of 2014 to 2015 to 2018 to 2019. The ear and hearing assessment training was made available to improve the skills base of health professionals with clinical responsibilities who had regular contact with Indigenous children within their community. This report determined that the provision of one-off training without the ongoing at-elbow support, capacity building and confidence building for health workers is regarded as insufficient to sustain quality ear health services. Other recommendations within the report said that the elements of a good training model for Indigenous ear health outreach services noted that their training should be Indigenous specific, culturally appropriate, delivered as close as possible to where the people are working, delivered in a series of short sessions, use new technologies, delivered face-to-face with web-based platforms, with regular support provided through at-elbow supervision and support at the workplace, which would lead to recognition, certification, and articulation within the vet sector and potentially to university, which is exactly what our program aims to achieve.
I think it's really important that we really understand the impacts of otitis media and hearing loss broadly for Aboriginal children and families. And here's a fantastic quote that Laisa Clegg, who is an audiologist, she's not practicing as an audiologist, a researcher on the project, said at one of our meetings. Deep listening, it's very embedded in our culture, not just as Yaegl Bundjalung person, but right across our nation. It's called Dadiri from East Arnhem Land, listening to one another. If there's a problem with hearing, kids are not learning this process of deep listening and connecting to the land and feeling the country. How we communicate is very much how we yarn with each other. This has been a really important quote for the team to really understand the broad impacts of hearing loss and of course otitis media that often precedes hearing loss on Aboriginal kids. We also recognise that there are a range of challenges which exist that can influence or cause otitis media, and this is demonstrated by a really lovely flow diagram that was developed by Deborah Lehrman in 2008. I think that the key thing to demonstrate is that within the project that we are that we've taken on, our focus very much has been on an acknowledgement of the determinants of health and determinants of otitis media, but in fact we're focusing on the early detection of otitis media to reduce its impacts and reduce the chance of it causing hearing loss. Or to reduce the consequences of hearing, the downstream consequences of hearing loss. The graph here is a graph from Hearing Australia that really demonstrates where the age at which children who have a hearing loss have been identified and first fit with a hearing aid. So down the bottom we see the different ages. And the white bars show non-Indigenous children, and the black bars show Aboriginal and Torres Strait Islander children and young people as a proportion of the total number who've been fitted across 1 year. I'm just highlighting that the high peak, which is shown here for non-Indigenous children, is the result of newborn hearing screening programs, but there is also a second peak that does occur at school age. For Aboriginal children, however, the time at which they are first fitted really is around this 4 to 6 year age group. So it is delayed and presumably considerably an impact of otitis media. Importantly and impressively, what Hearing Australia have been able to demonstrate is a shift in the median age of first fitting. So data from 2008 is shown in the grey bars, data from 2018 is shown in the black bars. So there is a trend and trajectory of a reduction in age, that kids with hearing loss have been first fit, or kids with otitis media that have been first fit. And Hearing Australia are very keen to continue this trend further down to detect and diagnose and fit kids at the time at which hearing loss becomes a problem.
Our research is collecting both quantitative and qualitative data through surveys and yarning groups, or yarn-ups, to capture and represent the voices and perspectives of Aboriginal participants. Our surveys were designed with Aboriginal researchers to ensure cultural safety and accurate terminology. The yarn-ups, or yarning sessions, are culturally safe environments where sensitive and important issues for the Aboriginal participants can be discussed openly. This open discussion is encouraged, where the participants influence the direction of the yarning. The yarn-ups were led by 2 Aboriginal research investigators, and our Aboriginal Children's Hearing Health Research Program's aim is to provide our scholarship students with a pathway beyond their diploma of audiometry, to offer them the opportunity to progress, to be a qualified practitioner, and the opportunity to continue on with further education and hopefully eventually become qualified audiologists. The aim of this study is to chart the pathway of our Aboriginal trainees, which you can see here, as they enrol in their diploma of audiometry and seek to complete this qualification and formal accreditation whilst working in the health sector. We expect that through tracking their employment and educational outcomes at enrolment, graduation, accreditation, and 1 year post-graduation, we'll identify the push and pull factors for recruitment and retention of Aboriginal people within the health workforce, and we'll hope to determine the structure and support systems that have been the most beneficial to building capacity within the Aboriginal ear health workforce. We expect to increase the number of qualified Aboriginal audiometrists in Australia by 500% or more. And this is our amazing cohort. Thank you so much for your time and for listening today.
Thank you for that. Great presentation, and all the best to get all those graduates through. I'm going to put a challenge to me now. I'm going to go to IHA and see how many they might have registered in their system. Yvonne, any questions or comments?
We've got a couple. So we've got a question from Damien House. Otitis media is a real concern for communities. Otitis media is a real issue for youth when engaging with authority. Is anything being done to educate police in community where this health issue is a significant problem?
Oh, so sorry, I was waiting for Cara to answer that. We actually have one of our scholars who's enrolled in the program actually works in the criminal justice system.
So she's working in the judicial system in health, and she has commented on the massive number of people that are currently incarcerated that do suffer from hearing issues, and it is a very, very important it's a very important factor that needs to be considered by the Justice Department and the police. I'm not sure of exactly what's being done to promote that more, but we are aware that of the Aboriginal people that are incarcerated, the majority of them do suffer from some form of hearing loss, and often are needing hearing aids and help with their to improve their hearing or to get treatment for their hearing. But when they are in the criminal justice system, when they are incarcerated, they do not have access to Medicare. And so they do rely on other services to come in to provide that care for them.
So our focus very much is initially on kids, but with as we're working collaboratively with additional partners, we'll certainly seek to broaden out these initiatives further. Yeah,
and in fact, it happens well before they get incarcerated. And the Pathways to Justice report that was done in December 2017 has a big section on hearing loss and the impacts of just first interaction with police and then going through the legal system before they even get incarcerated. So it's very much a health issue rather than a judicial issue.
That's right, yeah.